the moment we are finding ourselves, I talk about the pandemic, is still very much on. And definitely there's so much to say about the vaccine. Yes, there is so much for us to talk about the vaccine. So if you guys are ready, my name is Slimity. Good to have you guys again on the show this morning. Of course, in-house doctor, always looking elegantly dressed.
Okay, more.
Dr. Barth. Thank you.
Cute, as always.
Thank you very much. How are you doing, sir?
I'm fine.
Good to have you around.
Yeah, thank you very much. Good morning, viewers at home and around the world. We're happy to be back today on Health Matter, your regular weekly TV show on health. Today we'll be looking at coronavirus vaccine updates. You will agree with me that we're beginning to see plenty of light at the end of a very dark tunnel. As we speak, as of this moment, COVID-19 has affected over 130 million people globally. 130,807,190 persons precisely have been affected by this pandemic. And close to 3 million persons have unfortunately lost their lives to this pandemic. Specifically, 2,850,385 deaths have occurred as of today. And of course, 105,300,856 individuals have equally recovered from the pandemic. And of course, we know the Nigerian situation. As of today, it has affected 163,063 persons in our country. And within this figure, over 2,000 persons have unfortunately succumbed to this pandemic. 2,058 deaths have occurred in Nigeria. And in the last 24 hours, yes, over 2,000 people have died in Nigeria. 2,058 persons have died in Nigeria.
Wow.
You didn't know we've gotten to that far.
I didn't know.
As a matter of fact, we've gone beyond China, where it all started, by a far margin. It's unfortunate. Okay, and in the last 24 hours, 66 persons have been affected. I'm happy we are no longer counting in thousands, as we used to do some months ago. At the moment, I think it was about 11 or 12 days ago that we saw over 200 cases in Nigeria. So we have had, in the last couple of weeks a downward trajectory, and we are happy with the development, and that is why we are wishing that it will continue along that line, and that is why we are encouraging each and every one of us not to lose our guards. We need to keep up the momentum. We don't need to take our legs off the pedals. We need to continue to wear our mask when we're in public spaces, continue to social distance as much as possible, avoid crowds, wash our hands at all times. In places where water may not be available, you have to make use of your hand sanitizers or hand rub, if you like. And a number of other measures of prevention that we've been advised to do by the health authorities, talking about the non-pharmaceutical interventions. Okay, but this morning, our concern will be focused on vaccine updates. You agree with me that there's a lot of misinformation, disinformation, and rumors out there concerning vaccine. And of course, I can tell you today that vaccine hesitancy is not just an African or a Nigerian problem. It is a global challenge or a global phenomenon at the moment. Okay, down to business. So I'll be reading from my source, Coronavirus Vaccine Tracker from New York Times. As we speak, about 77 preclinical vaccines are in preclinical stages. These are stages where the vaccines are tried in animals. Okay. And about 82 are in trials in humans. And this stage is called clinical phase or clinical trials. And out of this figure, 23 vaccine candidates have gotten to the final stage. And 6 vaccine candidates have achieved what is referred to as limited use approval. 7 vaccine candidates have achieved full approval. Unfortunately, I would like to say unfortunately, 4 vaccine candidates have been abandoned. Okay, and we all know that there have been some growing concerns with respect to some of the vaccine candidates. Okay, and of course, it has actually affected people's confidence in coming forward to take the vaccines. But we are here this morning to reassure you, because I believe the way to dispel rumors or misinformation is to put the right information in public domain, so that everybody will be able to sieve the wheat from the chaff. Okay, so I want to start by saying that there are different types of vaccines.
Okay.
Having talked about the stages of development of vaccine, the preclinical and the clinical, of course, we know about the phases of trial, phase 1, phase 2, phase 3. When it gets to final stage, trials are done in thousands, in human, in large numbers. After that stage, of course, there are vaccine types. All the vaccines that we have talked about do not belong to the same type. They do not belong to the same class of vaccines.
Okay.
There are genetic vaccines. Among the genetic vaccines are the vaccine from the stable of Pfizer-BioNTech and Moderna. Those are the very 2 popular ones. They are called messenger RNA vaccines. You also have viral vector vaccines, under which you have the AstraZeneca vaccine and, of course, the Sputnik 5 from Gamaleya Institute in Russia. Okay? And, of course, you have the third one, the whole virus vaccine. A good example of the whole virus vaccine is the vaccines that are given to children at the age of 9 months, talking about measles. They are usually attenuated, weakened version of the virus itself. Now, the essence of giving this vaccine is to elicit immune reaction in such an individual, so that the body's natural defense mechanism can be spurred into action, okay? So that they will start producing antibodies that can counter against the disease whenever the body faces such a challenge. Number 4, you have the protein-based vaccines. And then lastly, number 5, we have the repurposed vaccine. Early in the development of vaccines, we do know that the common vaccines that are usually given to children, talking about the BCG, Bacillus calmette-guerin. The BCG, the popular BCG, was being repurposed. What do I mean by repurposed? They were trying to see if that BCG will have good effects on COVID-19. Along the same line, we have drugs that undergo repurposing. Of course, we do know the story of chloroquine.
Yeah. Yes,
it was and still is an anti-malaria drug of many decades ago that can be used in treatment of other medical conditions like SLE and some other autoimmune disorders. Okay, but early in the development of vaccine, this drug, early in the development of therapeutics, this drug was being tried to see if it could have good effects on COVID, and that is what repurposing is all about. Okay, you may not be out of place if you say out of label use. A drug that was originally meant for a particular purpose now being tried or diverted to do another thing, okay, to fulfill another function. We have a number of drugs along that line in medicine. So something similar also happened with respect to vaccines. But we do know that about a month ago in Nigeria, Nigeria was able to receive our first shipment, okay, courtesy of the COVAX initiative. That was on the 2nd of March, roughly about a month ago today.
Yeah.
And by a few days after, the vaccination campaign started aggressively in Nigeria. And I can tell you that the priority groups are coming up to take the vaccine. But we cannot close our eye to some of the challenges that people have raised concerning this vaccine. Recently, I think about 1 or 2 days ago, I came across a social media video that people were circulating of a woman who was said to have bled from the mouth, from the nose, after taking the COVID vaccine. As a lot of people called me, "Doctor, you've been talking so much about this vaccine. What is your take on that?" And my answer was simple, that every drug has potential side effects.
Well, there is nothing much, doctor.
Yeah.
Does it have to do with bleeding?
I will come to that. Okay. In medicine, that's what we usually refer to when we say when the benefit outweigh the risk. Even the water that you and I drink, if you take it, if you have a kidney pathology and you take the water beyond a certain measure, take excessive water, it will cause challenges for you. You will have issues. So
okay, maybe I will just reserve my questions because, like you know, in your words, I said excessive.
Yes.
So obviously, when you if you abuse something, there will be reactions.
But something like water, there shouldn't be anything like abuse.
If you jump into a pool and you cannot swim, it becomes an abuse because you know you can't swim, so you get drowned if you are not careful.
I agree with you. But the idea is to let us know that potentially anything at all, when it comes to toxins, will have one form of side effects or the other. Even drugs like paracetamol and augmentin, amoxicillin clovalenic combination. Sorry, I mentioned the brand name along the line. Now, these drugs, a certain percentage of people react to these drugs in the population. Banned drug like Anagin, for example, why was it banned? Because a few years ago, people were practically dropping dead after taking such drugs. And of course, the injection was banned. Another example is gentamicin injection. It used to come in various strengths, 80 milligram and 280 milligram. We only have 80 milligram in circulation today. The 280 milligram is no longer in circulation. It has been banned. Why? Because it causes ototoxicity. It can cause deafness in some people. Gentamicin in high dose. So you discover that virtually every drug
has their own side effects.
Of course. Even for the childhood immunizations that we usually take our children for, you discover that after some of the injections, they will start having fever. They will start having a number of vomiting and a number. But usually this will wear off. Those are not the side effects of concern. The ones that are of concern are the ones that could be life-threatening. Okay?
Like the bleeding.
Like the bleeding, the blood clot issues. Okay, but I can tell you that controversy with blood clots have been found in just one of the several vaccine candidates, that have been approved. Talking about the AstraZeneca Oxford vaccine. Unfortunately, that appears to be the one we have in the country.
That's like the major one we have here.
Of course, that's about the only one we have in Nigeria. But when you look at the population, for instance, UK, for instance, in the UK, they've given about 18.1 million doses of AstraZeneca vaccines. Okay, but the cases of blood clots that they've reported in the UK was just 30. So if you look at the number, it's insignificant to the number of people that have taken. But however, the regulatory authorities are not just letting everything slide by. They are taking measures and they are doing reviews. The European watchdog, EMA, will give an update in the coming days. I think it should be by 7th of April. Okay, for instance, Germany has given about 2.7 million of the AstraZeneca vaccine to their members of their population. And out of this, about 31 persons were said to have suffered these challenges of blood clot. And that is why today a number of countries are either putting restriction on the age of the people that can take the vaccine or putting a temporary suspension. It was like that with a number of European countries until about 2 weeks ago, when the international regulatory authorities came out to say, WHO and EMA, European Medicines Watchdog, came out to say that the vaccines are safe and effective. And of course, a number of countries resume again. Lately, in the last 24 hours, there were a number of issues occurring again. So, of course, there will be a review.
What do we say about, these persons that are, I don't know, overly affected? Like, what is actually responsible if we have more people that are not reacting and then we have few people reacting? Is it because their immune system is not that strong enough to take the vaccine, or what is actually responsible for those that are reacting?
Thank you very much for that question. Now, there's what we call hypersensitivity to drug. Some people will react to some, not just drug, even some environmental factors. Now, I give an example. What happens for somebody who is asthmatic, if the person is in a vehicle, seated in a bus alongside maybe other passengers, if a car passes by and then a truck passes by and then oozes a thick black smoke. Now, everybody in the bus may not get the same effect as people who may be asthmatic within that vicinity. They will start having choking sensation. If they are not careful, they may even end up in the hospital by just having a presbyterian that way. So we don't all have the same systems. And it's difficult to say who will react like this to one drug or who will not react to the other. But there are people who are known to have allergy, not just to drugs, even for foods. Some people that may want to try some new delicacies, they've ended up getting into trouble by eating what they were not used to. So it is a normal finding to have. But what we are saying is that the number of people given or granted that it has not been directly associated now with those cases, those isolated cases, okay? But that number is still very much negligible to the volumes of people that have been immunized. Basically, by taking the vaccine, we'll end up saving millions and millions of lives than the few that may end up, okay? We'll go on a short break and we'll be right back. Thank you.
Be right back, guys. All right, guys, good to have you back on the show. Remember, say, doctor, they talk about the COVID-19 vaccine update, and he don't talk so much before we go on break. And as a matter of fact, I remember, say, I've been also asking me a question, say, why we say those persons, like, thank God we get good number of persons when they react to the vaccine, but then we still have some persons reacting. Waiting they responsible, and maybe use the case of person where they asthmatic, where they inside bus, and of course they've been there exposed to smoke and all of that. So for those who have been joining us then, trust us, you actually had a good time. And yes, it's about to get better because we open the phone lines right about now. So that you really watch us for us, go ask your questions. If you don't get the vaccine, if you've taken it, share your experience with us. And if you have not, why haven't you taken your vaccine? All right. And if you get questions relating to the virus, you want to know more, you get reservations, observations, please feel free to call the numbers on your screen, 081054 3498 and 0817314759. Please turn down your TV volume. It's very, very important that we fit hear you very, 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 very well. So now, doctor, I don't know, but I'll always ask. I get like two questions here. First of all, when we launched, you talked about the decrease in numbers. The fact that the numbers are decreasing, and I don't know whether we should start celebrating, start jubilating. But then I would have loved to know what is actually responsible, because speaking about the vaccine, I know they brought was it 3 million doses to Nigeria? About 4 million.
Yes.
But going by the figures and the facts I've seen, I don't think we've had 1 million persons that have taken the vaccine so far. So now, if we never reach 1 million when they take the vaccines and then the numbers, they decrease by the day, what is responsible for that? And then secondly, if the vaccine does not guarantee my safety, in terms of if I take it, does it mean I won't get infected again with the virus? Why do I have to take it if at the end of the day I still come down with the virus?
Okay.
Do you understand what I'm trying to say?
Let me start from that last one.
Okay.
If it does not guarantee
my safety.
It does guarantee your safety, actually. It does guarantee your safety, actually.
Means I wouldn't come down with it if I take it?
No. Let me explain.
Okay.
Thank you very much for those two questions, wonderful questions. I must say, I get them always. Why taking the vaccine if it's not going to prevent me from having the infection? Now, the reason for taking the vaccine is not to prevent you from having the infection. Yes, some vaccines can actually do that. Okay. So because we have a number of vaccine-preventable illnesses. Okay. When you take the vaccine, some of them can confer a lifelong immunity on such a person. Okay, and the person won't have that challenge anymore. Okay, a good example that can easily remember is hepatitis B vaccine. Now, if you get immunized, I have a caller.
John from Lagos. Hello, John.
Good morning, Mr. John.
Good morning, doctor.
Yeah. How are you today, sir?
I just bless God. Your program is interesting. I'm John calling from Lagos, Navy Town.
Okay.
Thank you very much, sir.
Good to have you on the show.
Yes. I took the vaccine.
Oh.
I took the vaccine. It was a successful one. The only thing I noticed was 2 days later, I noticed I was having a sore throat. But I went to the clinic. They now gave me some vitamin C or so, which I took. And since then, I've been healthy. It's about 2 weeks now. I took it in our hospital there at Mobi Road. So people should not be afraid.
Yes.
It's a good vaccine.
Okay.
Even while I was there, somebody said we don't even know the importance of what the government have done for us. That it will get to a stage now, people will be coming and they will not be privileged to get it again. So I will encourage people to go for the vaccine.
Okay.
It's very good.
Thank you very much.
Thank you
John.
very much. You made my day.
I was about saying that too. That it just made our day because we just needed somebody that
of yours, so that Nigerians can know that it's not just our story.
It's not staged.
Yes, no, it's not far from that.
Yeah.
Okay, so back to your question. Now, what happens is that if you take the vaccine, you may still have the infection. You may still pick up COVID-19. Okay, so that's why it's advisable that even after taking the vaccine, still go ahead and put in place those non-pharmaceutical interventions. Of course, we know them. Putting on our face masks when we're in public spaces and all of that. Okay, because what it does is that it prevents you from having a severe disease. If you take the vaccine, you may have the infection, but the outcome will be mild. No, not the word chronic. Okay. You won't have the disease.
Oh.
That's the word.
Okay.
You won't come down with the disease.
Oh.
I think better put. You may have the infection, but it's going to be mild.
Oh.
You may have the infection even after taking the vaccine. Okay, so, but suffice also to say that some of these things are still subject of ongoing research. So we can't say conclusively. We have Felix from Abuja.
Has he also taken? Felix, have you taken?
Good morning, Felix.
Yes, good morning.
We need more testimony.
I have taken the vaccine.
Oh,
good one.
Yeah, though I was scared when taking it.
So were there side effects?
Until I got convinced by the nurse who gave it to me.
Okay. Did you come down with any side effects?
No. I had no side effect. Though that day I took it, I was a bit weak.
Okay.
After that,
Thank you very much.
I've not noticed anything bad.
You will not, sir.
Abi, it's over a week now, right?
Yeah.
Is it over a week that you had yours?
Yeah, but I still have, I don't know, if you are in a good position to answer a question I need to answer.
Yes,
Please
go ahead.
ask.
Go ahead, sir.
Okay. I have a planned trip, travel plan, and I don't know if I would travel with the certificate given to me that I've received the vaccine, or I still need to go and take the test. I have the test results.
Oh, okay, thank you very much. For now, I think what Nigerian authorities have put in place, in case anybody wants to embark on travel, I don't think it has been modified. You'll still go through the processes of getting to do the PCR test 3 days before or so, before your departure, before you leave the country to wherever you're going. But there have been talks of vaccine passport and all whatnot. But I do know that for now, no country or state has been able to institute such a measure for now. So, but the same protocol will still apply. The same travel protocols, okay, by the federal government will still apply for now, except that will change much later, probably when a good number of us or majority of us may have gotten vaccinated. Okay, because the good news is that the COVAX initiative expectedly, they expect to push about 600 million doses to Africa.
Oh.
And that will help to vaccinate about 20% of Africans. Okay, so at the moment we have gotten the first approximately 4 million doses.
Yeah.
We're expecting a lot more to come in. Other vaccine candidates too could also come into the picture. Okay, but I'm happy with that.
Okay. All right, now, so doctor, you're still on my question.
Yes, I've answered
You've answered one. So I said, why are the numbers decreasing?
Why are the numbers decreasing? The numbers are decreasing. Number one, I think one of the reasons why the numbers are decreasing in Nigeria, in Africa, not just because of the vaccines, because I can tell you the vaccines were just introduced
last month,
just about a month ago, roughly about that, okay, from now. But if you also look at South Africa, that couldn't use the vaccine candidate we are using in Nigeria for obvious reasons. Why? Because the South African variant was discovered not to be or to be resistant to the AstraZeneca vaccine and a number of other vaccine candidates. Okay, so as a result of that, I think South Africa was the first country in Africa to acquire the vaccine. They got the first in initial 1 million doses from AstraZeneca. But when the issue of variants, because that's an issue I will still talk about along the line. When the issue of variants...
Okay, let's say Ogaga. Ogaga, good morning.
Yeah, good morning.
Good morning.
Good morning, sir.
Yeah, good morning, sir.
Yeah.
All right, sir. Have you had your vaccine?
No, I've not had the vaccine. First, thank you for the program. We've been seeking for information, but we have issues. One, I think the information is just for privileged persons. We live in a country where there is no power supply in most places. And if in the cities we don't even have lights, talk less of those in the rural area. So I'm even fortunate not to even have power to be doing this program and getting few information. So talk less of the information around my environment. Do I know if the vaccine is going on? Where is it going on? So these are information we don't have. And that is one. Secondly, we have concerns if big countries can suspend the vaccine and complain about the vaccine. You won't blame people if they're having apathy in going to take the vaccine. So the question would be, what if now I decide to take the vaccine and there is a side effect, like someone saying maybe there's hemorrhage or whatsoever? What happens? What do they have in place to take care of me? You know, people have to be assured that, okay, the vaccine is safe, fine. There is a side effect. If there is a serious side effect, is there a provision made to rescue me from that side effect? So these are the things, once people are assured information, then there is a guarantee that even if there's a side effect, there's a provision for you to be, it's like an antidote or what you call it.
Yeah.
I think it will be fine. I think that's all. Thanks for your
Thank you very much.
He has raised a very key question there. He has raised a very key question there. That takes me also back to the story of the woman. I'll still come back to the variant.
No,
the
fine.
Woman from Kaduna. I wish her safe recovery. I hope she's okay by now. Now, his concerns are this. People who may have such serious side effects after taking the vaccine, who takes care of their medical bill? Are there provisions for such people to be given some degree of preferential treatment? Because I can tell you, it's difficult to tell anybody who was probably hale and hearty, nothing happening to him, and he goes to take the vaccine, and few hours or 1 or 2 days after, all sorts will start happening to him. It will be difficult not to link it to the vaccine.
Definitely.
It will surely be difficult not to link it to the vaccine. And I can tell you that, like I said at the beginning, it's not an African or a Nigerian problem. People have even died to such reactions abroad. And that is why it's being looked into. The European watchdog, Emma, will be giving an update on 7th of April. Dada from Lagos. Good morning, sir.
Good morning.
Good to have you on the show, Mr. Dada.
Yeah.
Please go on.
Dr. Barth.
Yes.
Sir, good morning, sir.
Dr. Barth.
Good morning, sir.
Happy to see you.
Thank you very much, sir.
Somebody that knows you.
Do you remember of your Laniba before?
Yes. Thank you, sir. Yes, thank you very much, sir.
My family really miss you.
Thank you, sir. Thank you very much. I appreciate, sir. Thank you.
All right. Thank you very much.
Thank you, sir. I appreciate it. Thank you very much, Mr. Dada. I appreciate it.
Okay. We'll come and see you later.
Thank you very much, sir.
So his family doctor. Okay, so doctor, let's just continue.
So that is the truth. The side effects that may come out from people who are taking, people need to be reassured that should you have any adverse drug reactions, severe adverse drug reaction. The government will be there to take care of you.
Go.
Yes, where to go or which numbers to call. I know that for drug reactions, we have a number, pharmacovigilance number that one can actually contact. Okay, so such should also be instituted and then made known to people so that people will know. But for now, I think what that has to do is that you can go back to where you had the vaccine. And then report whatever concerns you may be having with respect to the vaccine. You may go back to where you got the vaccine and then report to them, and they will take it off from that. Because as it stands now, it's only government centers that are authorized to give the vaccines.
Okay.
The private institutions have not come into the picture.
Okay.
But hopefully with time, that will be possible. Okay. So talking about the vaccine, the COVID-19 variants, that is a challenge that the scientific community are still trying to battle with. I can tell you that South Africa, like I was saying before one of the calls came in, they were one of the first countries. Okay?
Okay. I think we'll just pick it up from here when we come back from the break. So guys, stick around with us. We'll be right back. Okay, so I'll just go straight. Let's continue from where we stopped. Doctor, so are you going to answer my question now? Why the numbers are decreasing?
Yeah, thank you very much. The reasons, in my own understanding, why the COVID cases we have in the world is having a downward trajectory at the moment. I can tell you from beginning of this year, we're having about 5 million cases per week, and that dropped by mid-February to about 2.5 million cases. On a global scale, one may be responsible for the downward trend may not apply in all the countries of the world. Okay, but I can tell you that in some parts of Africa, number one reason is under-testing. If you don't test many, you're not likely to discover many numbers. Okay, so if you're under-testing, you'll be under-reporting. Okay, or under-discovering. Okay, that's number one. And that may not be the case in US and a number of other countries. Number two is the adherence to coronavirus countermeasures.
David.
That's number two. David, good morning, sir.
Yeah, good morning, doctor.
Yeah.
Yes, I want to confirm something. There's something that is going on trend. You talk about after they given the drugs, the vaccine, the person will be immune. What about those who are infected? Can the drugs work for them? Because I keep noticing that they keep talking about death after the vaccine is already rolled out.
Did he get himself?
Come again. Make your question clearer, sir.
Okay, I said they said the vaccine is immune to the virus. But I noticed that people keep dying in the hospital. Is that vaccine not working for those who are still in the hospital?
Oh, you see that once you're infected,
okay. Thank you very much. Different vaccines have actually different indications and contraindications. Okay, now let me start by saying that anybody who has caught COVID in time past or has been infected is still qualified to have the vaccine, but not so for a number of other vaccines. So it's not a general rule, so to say. Okay, now why do people still die even after taking the vaccine? I'm not sure I've had reported cases along that line, but it's a strong possibility. What the vaccine does for most of people who have taken it, number one, it reduces your chances of having a severe infection should you have the infection along the line. So you may just have a mild infection. You won't come down with the disease. Some will even prevent you from having not just the severe disease. There's even some studies that are saying some will prevent you from not getting the infection at all. But like I said along the line, there are still a whole lot of gray areas about the vaccine development. In the coming months to years, we'll have a clearer picture. Okay, but as it stands now, anybody who has been infected before can still go ahead and take the vaccine so that the person doesn't have a second disease. Okay, why are people dying? The vaccine have not gotten to everybody just yet. Or a number of countries of the world are struggling to get the vaccines. So the numbers we have available cannot go around to all the people that are standing on the queue to benefit from this vaccine. Thank you very much. So I was talking about why the global infection rates are dropping. And number one, I said, because in some countries it could be alluded to the fact that they're under testing and under reporting. Number two, I also talked about adherence to coronavirus countermeasures, like wearing of face masks that we have in place, washing our hands, and taking some other non-pharmaceutical interventions or measures. Number three is the changing seasons. The seasons have been found to help to increase the infection rate in some countries of the world, but this is not yet completely proven. And then lastly, of course, we cannot rule out the fact that the increased COVID vaccination that have happened in a number of countries have helped to bring down the rates. A good example is US. As we speak, about 17% to 18% of their entire population have been vaccinated. They've taken at least 18 to 20% have taken at least one. Okay, so UK too has done tremendously well along that line, but that cannot be said for the rest of Europe. They are still struggling. The rollout was poor in some areas. Okay, so those are some of the reasons that have helped to drop the infection rates. And additionally, there is a greater understanding of the virus than it used to be at the beginning. That also could also be a factor, could be responsible for the downward trend that we're beginning to see. Okay. Now, talking about the variants that are resistant to vaccine, notably among them are the South African variant, the UK variant, and of course the Brazilian variant. We've talked about them plenty of times. They are known to be resistant to some of those vaccines. And that is the reason why South Africa today does not have, they suspended the rollout they did with AstraZeneca Oxford vaccine candidate.
So there are too many reactions?
No, not because of reaction, because the South African variant that was dominant in South Africa, the vaccine was found not to be effective for that. So about 1 million doses that they acquired were donated to African Union. Okay, so what is obtainable in South Africa today, the vaccines that are given to their population is the Pfizer-BioNTech vaccine candidate with that of Johnson & Johnson. Okay, so, and a number of other countries of the world. In Europe, for example, talking about the varied advice on AstraZeneca vaccine, France and Canada are restricting the vaccine to people over 55 years. Germany is recommending it only to people over 60 years. That's for Germany. Italy is restricting the jab to people under 80 years. Austria and UK have no restriction in place. Sweden and Finland are using it only for those over 65 years. In Norway and Denmark, the shot is suspended until at least mid-April. Switzerland has not still approved the jab at all. That is for AstraZeneca vaccine candidates. Now, I read out this thing because there's this age-related
efficacy. Because I was almost asking that the one in Nigeria is for everybody.
It's not for everybody. It's not for children. Okay, there's age gap that should go for the vaccine. Okay,
the AstraZeneca.
Yes, the AstraZeneca vaccine candidates are beginning to do trials for young adults, adolescents and young adults, 12 to 17 years. So I think people who are less than 20 can actually not go for the jab now. But it has also been found that some of the in places where people have probably suffered some of this blood clot issues, okay, that we've talked about at the beginning, it was traced to a particular age group, people below 60 years of age.
Okay.
Good morning, sir.
Gbade Geshin. Mr. Gbade Geshin.
Good morning.
Yeah.
Good morning. How are you doing today?
I'm fine. Hello,
all right.
Doctor.
Yeah. Good to have you on the show, sir.
Thank you. Good morning. How are you doing?
Please go on.
I want to have a question about the vaccine update.
Yes, please go ahead, sir.
COVID-19 vaccine. Yeah. I heard in some states they are taking this vaccine. And later they were telling us that immediately they take the vaccine, they die, or some they have clotted blood. So and we don't understand the reason why this thing is happening. So I want you to please enlighten us immediately.
Thank you very much. That's what we were talking about a while ago. Now, the blood clot issue, the medical name for that is cerebral venous sinus thrombosis. Cerebral venous sinus thrombosis. Okay, CVST. And also it causes reduction in the number of platelets. We can predispose such an individual to bleeding. That is what the thinking is. Okay, but the regulatory authorities have not yet linked up these reactions or these blood clot challenges to those vaccines. The research is still ongoing. Their last position as of 2 weeks ago is that these isolated cases of blood clot issues, that was as of 2 weeks ago, cannot be directly linked to these vaccines. Okay, but the truth of the matter is that whether that is their position or not, a good number of countries have taken measures to prevent their citizens. And of course, I just read out some of the countries that have put varied restrictions on the vaccine, the ones that are suspended and the ones that have allowed it to go for a particular age group. Okay, it has also been found that part of the majority of the people that were affected with these blood clots were women. Take, for instance, what happened in Germany. About 31 persons that were affected, 29 of them were females. And their age range was between 20 to 56. And unfortunately, 9 of those people, 4 or 9 of those people died eventually. So it is a serious issue, actually, that is affecting people's confidence. Okay, but in Nigeria, we have not officially reported anyone. I said in the beginning that I came across a video of a woman who, but that has not been official. Now, the only official record I have of that was that the hospital that treated the woman came out to say that the woman presented to them 6 days after she had a challenge, and they've treated her and she's doing well. Okay? So that is still not yet clear. But in all of what we have said, the take home here is that this vaccine in UK, for instance, AstraZeneca vaccine, they've given out 18.1 million doses. And the people that were affected adversely, they were said to have been affected adversely, were less than 30. So the number is still insignificant, okay, in comparison to the people who are having issues. We have also had testimonies on the show from a few Nigerians, okay, who have taken the vaccine, coming out to say that I've taken, and I did not have anything, I'm fine, and I'm ready to take the second jab.
So I believe that by next we'll have more persons that will tell us, give us their testimonies on.
So thank you very much. Our advice is that you should go for the vaccine. It is safe, it is effective, it will help you.
All right, so while you're taking the vaccine, or while you're waiting to take the vaccine, please do all you can to still stay safe. It's very important. Like
keep social distancing, keep using your face mask.
Key, your face mask, wash your hands regularly. For now, when they go one bed today, make sure you go around with your sanitizer. It's also very, very important.
Yes,
Doctor, thank you very, very much for coming through.
From us,
bye.
It's bye-bye for now.